Happy Monday, New Beauty followers. Tatiana Bito here, features editor. And today we're going to talk about hair loss treatments. And I'm looking at our summer issue, which I'm so proud of. It's so beautiful. And we have a gorgeous hair story here. We're going to talk to Dr. Jeffrey Wise, facial plastic surgeon from Wayne, New Jersey, and he is going to tell us everything we need to know about how to stop thinning hair, how to grow thicker, stronger, longer hair, and all of your hair questions. So please drop a line and let us know what questions you have. Let me patch him in. Let's go. We're connecting. Hello. Hi.
Hey, Tatiana, how are you?
Good. How are you, Dr. Wise?
I'm doing great. How are you guys doing?
Good. And I was just telling our followers to look in the latest issue of New Beauty, and we have this gorgeous hair story, and you're quoted in here, so you're the perfect person to talk to today.
Good. Well, I'm glad to be here. It's really fun.
So, what are the common causes of hair loss or thinning hair, or some of the common hair concerns women face as they age?
Yeah, so unfortunately, the most common cause of thinning hair in women and men is actually androgenic alopecia, which is essentially a fancy word for saying genetic hair loss. So unfortunately, most of the hair loss that we experience throughout our lifetime is actually something that we don't have a lot of control over.
Right. We inherited it.
Yeah, exactly. You just kind of, it's the way you're programmed. Unfortunately, you can look to your relatives, particularly females can particularly look to females in their family. You know, we've always heard of this myth that you look to your mother's side of the family and so on for hair loss. But we found that it's a lot more complicated than that and a lot more nuanced. And we found that it's not one side or the other that inherits hair loss or gives us our hair pattern. But it's kind of complicated.
Sides?
Sorry?
So look at both sides of the family.
I would look at both sides of the family. If we're talking about female pattern hair loss, I would look very carefully at the females in the family.
Yeah.
And see how they were doing, let's say in their 30s, 40s, 50s, and so on.
We often think of hair loss as a huge concern for men, but how many women are coming to see you for hair loss treatment?
Yeah, I mean, we find that women surprisingly are kind of an overlooked population when it comes to hair loss, which is crazy because you know, females who lose, you know, female hair loss could be pretty devastating for people and really hurt their self-esteem and so on. So we see a ton of female patients in our office. The way we tackle female hair loss versus male hair loss is actually quite different. So you know, they're really men seem to get a lot of the attention. Particularly with hair transplantation and so on, but females are a big part of my practice.
What are those differences between male and female hair loss treatments?
Well, it really revolves around what the various treatment modalities are. Females tend to undergo fewer hair transplants than men do. The medicines that we prescribe women are also different based on testosterone, and especially women of childbearing age. You have to be a little more careful with some of the medicine that we give to the men. Okay.
And so how do we prevent hair loss? What products can we buy? What can we do at home?
Sure. So there's a couple things that you shouldn't do, right? I mean, that's because as we talked about, you know, most hair loss is genetic. However, there's things that we do to our hair that's not in our hair's best interest. So one of the big common things that we'll commonly see in the office is, particularly in females, are females who have something called traction alopecia. And traction alopecia is actually caused by excessive pulling of the hair. And we don't mean pulling of the hair like people pulling their hair out.
Right.
That's called trichotillomania, which is a whole different psychological illness. But we're talking about women who, you know, with the best of intentions, wear their hair, let's say, in a tight bun. They could put braids in their hair. And they have a very characteristic pattern of hair loss. We usually see it, hair loss in the temple areas and also in the frontal region. So that's a very, very common cause of hair loss in my practice. As far as things you can do to prevent hair loss, by the time women or men, for that matter, feel that their hair looks a bit thin, we've typically lost almost 50% of our hair in a given area. So that's actually quite a bit of hair loss. And the time where we start noticing hair loss and the time where it gets probably what we consider severe is actually a pretty tight margin. So as soon as people recognize hair loss, it's probably prudent at that point to consult with a hair care specialist, whether that be a hair surgeon or a dermatologist. In addition, it might be a good time to get on some sort of non-surgical or non-invasive medication. For example, I commonly prescribe in my office, we recommend either Viviscal or Nutrafol. These are vitamin supplements that are kind of like one-stop shopping for hair health. They work terrifically. There's very few contraindications. There's very few patients who can't take these in a very safe manner. They don't really interfere with other medicine and things that we might be concerned about. And that's just a simple vitamin supplement to keep their hair healthy. As we move up in the hierarchy of things to do, we also offer topical therapies. So this is something that we've actually concocted here at the office. There's a male topical solution that we have, and also a female, and they contain different things. The male solution contains minoxidil. Minoxidil, as many viewers might know, originally was a vasodilator or an antihypertensive or blood pressure medicine, but we found that it actually brings more blood flow to the hair and actually grows hair. So it's pretty remarkable in that respect. And it's topically, it's commonly referred to as Rogaine. It's available at any grocery store, supermarket, Costco. Lots of people sell Rogaine. I would recommend getting at least the 4 or 5% strength. We have a solution here that we offer in the office. It's actually 7% minoxidil for the men. That
one is for men.
Yeah, so this is for men. Men also, we commonly place men prophylactically on something called finasteride. Finasteride is what we call a DHT blocker, and that actually blocks one of the enzymes that causes hair loss. It's a very, very common medicine in men. The efficacy of the drug is really, really compelling. It's been really, really effective and a really important medication in the fight against male hair loss.
But women can't take it?
I don't typically give finasteride to women of childbearing age because we think that it may interfere with their hormonal milieu, so we don't like to do that. However, for the women, we do have a women's solution too, and this women's solution does not have finasteride in it. It has minoxidil, which we talked about, which can be used by either gender. It also contains something called tretinoin, which we commonly use for skincare. What it does is it thins out the scalp skin a little bit to allow better penetration of the medicine. It has a steroid in it also, which actually is very, very effective for some sort of autoimmune hair loss, which is very common in women also. So the combination of minoxidil, isotretinoin, tretinoin, and fluticasone, which is a steroid, can be very, very effective for the female pattern of hair loss. So that's why we use it.
That's a topical serum, right?
Correct. So this topical solution or serum, we recommend that patients use it approximately twice a day. It's fairly straightforward. There's a dropper that comes with it. Most of the solutions have that. And we find that it really helps with the female hair loss.
We have a follower question. Do you think topical solutions are more effective than oral supplements, or do you recommend using them in combination?
Yeah, so the mantra, if you will, for hair loss is really a multimodal approach. So what we mean by that is the only thing better than doing one thing is to do two things. The only thing better than doing two things is to do three things. So the more things that we can throw at it, the better. So it's really not an either or. It should be well, let me do both of them, because that really the combination therapies tend to work very, very nicely.
And how often would you use the serum, and would you only use it where you're having thinning hair, or would you use it all over?
Yeah, I mean, typically I would use it all over what we consider the halo area. So if you think of like your head as like, obviously a halo or a circle, most women and primarily men as well lose hair in that area. So that's really where I would use it. Putting it around the outside of that halo area not quite as useful. So I wouldn't recommend it because it's just wasting the solution.
I have a question about hair loss after giving birth to children, because there's like this peak when you're pregnant. You have the most beautiful, and afterwards, 9 months and after, a year after, you just have this gorgeous head of hair, and then it takes this steep decline. I mean, that's my personal experience. I don't know about everybody else. And you just start seeing more and more hair in the hairbrush.
Yes.
So
yes.
Why does that happen, and how long should you expect to see your hair thinning out after having kids?
Yeah, so that's we see this all the time in our office. As you described, pregnancy hair is like absolutely fantastic. It's thick, it's luscious, it's full, stronger than ever. But as we know, it's like hormonal World War III during pregnancy and shortly thereafter. So there's the decline in certain hormones creates possible shedding or we call it telogen effluvium or TE. So we recommend taking some of these supplements right after pregnancy. It can mitigate some of the effects. The effects can last many months, even over a year, because remember, once you lose the hair, especially with women with longer hair, it takes years to potentially regrow your hair. So we obviously want to prevent that kind of hair loss, although some hair loss after pregnancy can be inevitable, unfortunately. But we oftentimes will do these treatments, and also platelet-rich plasma, or PRP, and I guess we can talk about that. It might be a good segue.
Before we move over to PRP, what are the main ingredients in Viviscal and Nutrafol that you like that patients should be looking for? Yeah,
so the most important hair supplement as far as vitamins is biotin. Biotin is really kind of the gold standard for hair and nail growth. I think the most important thing is, as far as like milligrams and like quantities, you have to be really careful of the packaging. So I would just consult with whatever the package says, because to give an absolute number can be misleading. So every formulation is a little bit different. So you have to be really cautious about that. The reason that we like these products like Viviscal and Nutrafol is that it's kind of like, it kind of dumbs it down to the extent that you don't have to worry about that stuff. It kind of creates it all for you. And so that's why we prefer, because every formulation is different.
It's formulated in the best way. It's not just biotin off the shelf. It's formulated specifically to give you the best results for hair growth.
Correct. I mean, just for Nutrafol, I can tell you that it has, I'm just reading the box because I can't memorize all these things. But, you have the A, C, D, biotin, iodine, zinc, and some other less important ingredients. But there's just a ton of things to these things. So that's why getting a formulation is probably advantages someone more than trying to kind of piecemeal something together.
Tamra Delbridge says, thank you for addressing this, and she has PCOS and has lost so much hair in her crown.
Yes, that's PCOS is something we also see a lot of. PCOS is a polycystic ovary syndrome, and what that essentially is an increase in androgens for females. So sometimes with those, you might see irregular periods. You might see weight gain. You could potentially see body hair where you might not want it. And also hair loss is another part of it. For PCOS, we actually oftentimes will put patients on spironolactone. That's an androgen blocker that's safe for women. Yeah. It is a diuretic and a blood pressure medicine. So you have to be really careful and consult with your doctor to make sure that it's something that a patient can tolerate.
So you can't just add it into your routine without making sure it's safe for you.
It's available only by prescription. So it's really important that you consult with a physician before obviously starting it.
Lizzie Liz 561 said, how would this work? And I'm assuming it's the options that you've already shown. How would these work for a COVID survivor that has lost a lot of hair? Wow,
that's new territory. I actually had started seeing it in my practice. Some people who had COVID. Yeah, we actually saw that. So first of all, congratulations to her for recovering. That's awesome, of course. this is we haven't really fully elucidated what causes hair loss in COVID specifically. We have seen that people with acute illnesses, however, whether that be God forbid, like cancer, heart attack, a really bad, even a really nasty flu, surgery of some kind, can cause a delayed amount of hair loss, and that is a variant of something called telogen effluvium, which is TE. So the best treatments for those are usually waiting. I know that's not a great answer, but usually the good news is usually it does come back. But we can certainly help things along by using the supplements, by using PRP, and we can talk more about PRP in a bit if you want. But that's really what it is. It's generally not hair transplantation. So I wouldn't jump to a surgical remedy, but certainly some of the non-invasive therapies can kind of get the hair back on track. But it's a slow process, obviously.
But should you wait until you've fully recovered?
Oh yeah, I mean you have to. I mean you can't, because you don't want to start therapy for hair loss, for hair regrowth if you're still undergoing some sort of treatment. It doesn't make sense.
So let's talk about PRP, because I think people have questions about it, and it seems very mysterious, but it's actually using our own, using your own body to generate hair regrowth. So can you walk us through what is PRP and how it stimulates hair regrowth?
Right. So PRP is something that we do dozens of injections a week in my practice. Very popular treatment. It's a non-surgical therapy, so we use it as a standalone procedure, but we also use it in conjunction with hair transplantation. But what we find with it is basically it's platelet-rich plasma. So what we do is we essentially draw someone's blood just like normal through the vein, like you would at any doctor's office or laboratory. We usually draw, in my practice, we usually draw about 100 cc's of blood. That's obviously a bit more than you would draw if you were going for like a diagnostic test, but it's far less than you would need if you were, like, let's say, donating blood. So you're not stumbling out of the office or anything. You have plenty of blood left. It's a fraction
of
what
you would actually. Each treatment. So you're doing it for that particular treatment.
Correct. And just to be clear, every doctor or center does things slightly differently. We use a special system in my office called the Otirosite or Magellan system. We've had some really terrific results for it. And basically what PRP is measured in is the quantity of platelets. So what you're doing essentially is you're taking the whole blood, and there's all kinds of components to blood, and we all know this. But what we're doing is we extract out all the platelets with a special machine. And by taking out all the platelets are what have all of the growth factors. So what we do is we take this 100 cc's of blood, we put it in a special machine. It's called a dual spin centrifuge. And we take out all the platelets. And usually what we do is we get PRP that's about what we call 7x PRP. And 7x PRP basically means that the number of platelets in our PRP is 7 times more concentrated than what you'll find in whole blood. So it's a lot of platelets all slurried together. And once we have those platelets in hand, we actually do anywhere between 60 to 80 injections into someone's scalp, and we put it right into that layer where the hair bulb is. And the hair bulb is like the source of it's the living part of the hair. So we put it in that little area, and that releases all these growth factors to the hair and should slow down hair loss. It should cause hair regrowth, and it actually wakes up hairs that are in something called the resting phase. So we want to see hairs in the growth phase, and so we want to take them out of the resting phase to the growth phase, and that's what PRP does really beautifully. And we've been doing PRP. Sorry.
I'm so sorry.
No, it's okay.
Do you just treat like where the hair loss is when you do PRP, or do you treat all around the scalp?
Yeah, so I typically treat the entire scalp because we want a lot of PRP and we want to put it all over the place.
Okay.
What I will do, of course, is bias it towards areas where there's hair loss. So if, let's say, a female comes in, let's say Sally comes in for hair loss, and she finds that the most severe amount of hair loss is in the frontal hairline. We'll actually do the entire scalp, but we'll definitely give her extra dosing in the area that she's concerned about and where you see objective thinning. So we'll obviously bias it towards areas that are in most need.
When you see the results back, do you see those areas where you're concentrating more of the PRP have more, a better result?
Yeah, because we're starting with a poor situation, and typically those are the areas that we treat the most aggressively. So we often will see the better results in areas that we've treated the most aggressively. Just to give you some, yeah.
Sorry, I was just gonna say it's so fascinating, and if you're watching and you've never seen PRP for hair results, go to Dr. Wise's website and take a look. It's really fascinating, and it's amazing how regenerative our bodies are, and that you could do that. Even I think five years ago I started seeing PRP coming out and being used in different ways, but like 10 years ago we would never think, oh, we're gonna take platelets out of our blood and our hair's gonna grow back. It's just fascinating to me.
Oh yeah, we've seen incredible results with it, and remember, everything's derivative in some way. So PRP was originally used for wound repair, and also for joints. I'm sure many of the viewers may know it for orthopedic use, like people injected into torn joints, stuff like that, and it seems to heal the body faster. And then of course we started using it for other aspects of plastic surgery, including the hair, and we've seen some really fascinating results with it. It's really exciting. We've been doing PRP in my center now for probably about 7 or 8 years. Yeah. And the techniques have evolved. We're not doing exactly the same as we did, let's say, 7 years ago, because we've seen some improvements in the technology, but we've seen some pretty incredible results with it. I mean, I think the thing that appeals to people the most about PRP is it's essentially an autologous treatment. And what we mean by that is you're basically using your own body. So you're not injecting foreign substances into the body. It's obviously not a pharmacologic treatment. So you don't, some people get concerned about, well, I don't want to take drugs. I don't want to inject stuff into my body that's not my own. And the advantage of PRP is we're actually using your own stuff, if you will, to help with hair loss. So it's fascinating stuff, and the results are really pretty awesome.
How often do you have to go back for maintenance?
Yeah, so typically what we'll do is we'll have an initial kind of a loading dose of PRP. So most patients will undergo a series of 3 treatments, and those treatments will be approximately 1 month apart. And then we usually have maintenance treatments approximately one treatment, not 3, one treatment about every 6 months. Now, I do have patients, just to be clear, I do have patients that are kind of all in, if you will, and it's perfectly safe to do PRP once every month or 2 in perpetuity. But it is a mild, a minor procedure. So there is a little bit of downtime, usually a day, maybe 2. And it is, obviously it does get expensive.
Who's a good candidate for PRP and who's maybe not the best candidate?
Yeah, so obviously anyone who has any blood disorder can't do PRP, right? So you need good platelets in order for us to use your platelets to help you. So if you have thrombocytopenia, which is a fancy word for saying low platelets, if there's some platelet disorder that you might have, that's obviously not a good move. People with significant balding, for instance, like men who have severely receding hairlines, who have like no hair in a given area, you can't. It's like I always kind of equate it to like watering a desert. You know what I mean? You're not gonna grow anything without any seeds there. So you need to have something on your head in order for this to work. So it really is best in areas that are a bit thin, or we call transition areas, where things are a little precarious, but certainly not where there's no hair.
Right. So you have to have something to work with.
Correct. Exactly. I can't inject PRP, let's say, on areas where you have no hair and expect to grow hair.
Also, I would assume if you are not someone who is going to keep it up and go every 6 months, and you need a more permanent solution, it's probably not, if you don't want to continue treating it over time, it's probably not an option.
Yeah, I mean, there are some cases, just to be clear, that there are some cases where you may need PRP for like 1 cycle, and then you've kind of gotten back on track. We mentioned earlier in our discussion about someone who, let's say, had COVID, right? And they took a real hit with the COVID. It really wore them out. They lost their hair, but as they recover, PRP kind of helps them along, kind of gets them going. Yeah. And then they're, as they get healthier and stronger, their hair also gets healthier and stronger. We're giving them kind of a push in the right direction, and then they're okay. Another example is,
all right, if you have a little spot or, you know, like a little section, maybe up here, like I have this here, even though it's not worthy of going into anyone, but
Right.
but if you have like a little section and you want to try PRP, if you do it once or twice and never go back again, is the hair gonna still keep growing?
It certainly gets things going, but I think if you don't have any sort of follow-up at all, in many cases, it's not as useful.
Right.
So yeah, your point is well taken.
So you have to, I'm just thinking about people who might need a longer, more permanent solution. So what would that be? Would that be surgery?
Yeah, typically we're kind of getting into the more of the surgical world now. Yeah.
So what are our surgical options if we want to get rid of the problem, treat it, and sort of be done with it?
Right. I hear that a lot. I want to just be done with this. You know what I mean? I don't really want to deal with this anymore. Yeah. Well, of course you don't. But anyway, I mean, we're kind of into the more of the surgical solutions. So we're really talking about, when we say surgery, we're really talking about hair transplantation. And as many of folks in the audience realize, there's major surgeries and there's more minor surgeries. And so in the big scheme of things, generally speaking, hair transplantation is a fairly straightforward procedure. It's very safe. It's done under mostly local anesthesia with maybe mild sedation. So what we mean by that is you don't need to have general anesthesia. Let's say you're having breast surgery or a tummy tuck or some other surgeries, or most surgeries, you might need a breathing tube and to be intubated under general anesthesia. This doesn't usually require that, especially in my hands. We don't do that. Typically, what's involved is there's no major incisions, there's no big cuts and all that stuff. The most common hair transplantation technique that we've been doing now in the last many years is something called FUE. And FUE stands for follicular unit extraction. And what that essentially means is we go in the back of the head where the hair is very strong, and we take out the hairs individually.
Okay.
And when we do that, we don't make any big incisions or anything like that. We're literally taking the hairs out individually with a special machine. And in my hands, that machine has a punch, like a little punch, that's about 0.7 millimeters. That is like really tiny. And so we're making thousands of those little dots, extracting the hair out, in a what we call a follicular unit. A follicular unit, if you look at the scalp, let's say under a microscope, you'll see that each hole in the head is considered a follicular unit. They may have one hair come out, 2, 3, or maybe 4 sometimes. So we're taking those hairs out in their units, and then we're making tiny little needle sticks in the head, and we're putting those grafts in, essentially. And the recovery is rather fast. The pain is minimal, and patients do great with it, and it's essentially permanent.
How long does it take? Well, I guess it would depend on the patient. But
completely depends on the patient. We did a hair transplant today on a gentleman, just to give you an example, and he did 3,000 grafts. So 3,000 grafts are 3,000 follicular units. And those units, once again, could be 1, 2, 3, 4 hairs. So all told, we probably transplanted today with a 3,000 graft case. We could have transplanted something on the order of maybe 6,000 to 8,000 hairs.
Wow.
To give you some example of how long it takes, we got here early in the morning, and we essentially just finished. So it's actually a pretty long day. But most of the time, the patients are resting comfortably. We do nerve blocks at the beginning of the day. So a couple tiny little baby needles in the beginning of the day, and they're basically numb the entire day. So it's really easy.
You're plucking each individual follicle, bulb, or whatever, the whole thing out, and just, I mean, this is so rudimentary the way I'm saying it, but like you're like just planting it. It's so much like plants in nature, but you're like putting it out and replanting from the back of the head to more visible areas where there's no hair growth.
Correct. Now it's a little so it's a little bit of a misnomer, because a lot of patients say, well, are you like tweezing the hair out? We're not doing that. Just to be clear, we are actually going in with a very sharp instrument. Everyone's known, of course, and we're coring out the what we call the adnexal tissue. So we're coring out a tiny little sliver of skin there too, which supports the graft. So it's a living organism that we're implanting, not just the hair itself. Right. If that makes sense. Yeah.
That does make sense. So it makes sense also why it takes so long, because it's intricate process.
it's extremely tedious, but we love it.
But it actually, when you describe it, doesn't sound as a huge of an undertaking of what I thought in my head a hair transplant procedure would take. It actually sounds, you know, a little less invasive than I mean, it is invasive, but less of an undertaking. Like you said, it's not, you know, a breast implant surgery or something like that. So
yes, I mean it's very labor intensive, and it's a very, you know, incredibly gratifying and high yield procedure. But on the other hand, it's not quite as invasive as people might think. And
right,
you know, the technique nowadays compared to, let's say, when people got like plugs, everyone uses the term plug. Yeah. It's nothing like that anymore. In the old days, we're talking about anywhere between 15 to 30 years ago, people would essentially have what we call macro transplants. So instead of a 0.7 millimeter punch that we use now, they would use something like 3 to 5 times the size of that. So that's why you look at some, particularly men, and they have these like almost like these doll's hairs.
Right.
And this is not done anymore because we're taking the grafts out exactly how they occur in nature and on your head. So it's like it's identical to the way it looks in real life. It's very unusual nowadays in the proper hands for you to identify someone who's had transplants. It's almost impossible. I mean, I can, you know, like many celebrities have undergone hair transplants, and you would never know it.
I think there was one who just came out during quarantine. I forget his last name, Cheyenne. There's a Broadway and TV actor, and he came out and said, I just want to come out and let you know I had hair transplant surgery a couple of years ago. You would never know.
Yeah.
But for women, it's the same process, right?
It is the same.
Is the same.
Yeah. So, I mean, obviously, there are extreme, you know, there's a lot of nuances, of course. So female hairlines are different. So a man's hairline is, you know, slopes back a little bit. A female hairline is a bit more oval. So we design things differently, of course, to accommodate the differences in the genders. But the rudimentary principle of it is very much the same.
And you said before that you do also use PRP sometimes, even on your surgical patients. So
absolutely. We use it. Yeah.
Is that an in conjunction, or try this first, or both?
It could be both, but we typically do PRP treatments at the time of the procedure in about 90% of our hair transplant patients. And the reason that we do that is it helps with healing, as this has been well described. It helps with healing. We also soak the grafts in PRP, so it actually helps nourish the grafts while they're out of the body. And then we also use PRP because we don't transplant usually the entire head. We'll transplant part of the head, and we use PRP to nourish the other parts of the head. So it's used often as a kind of a useful tool in conjunction with surgical procedures.
So when the grafts are taken out, you put them in PRP before you put them back in?
Correct. I mean, we do other things to them, like chill them. We put them in a special holding solution. We store them at exactly 4 degrees centigrade. I mean, there's all kinds of nuances to it, but yes.
Yeah. We have 2 questions. Is the new hair that grows stronger? And then since you lose your hair daily, can the new hair fall out again?
Are we talking about in terms of a transplant?
I think so, yes.
Yeah, so in terms of every hair on your head undergoes a hair cycle. So every hair on your head falls out eventually. So we don't stop that. Essentially, your transplanted hair behaves exactly like the hair would at the back of the head, where you don't lose hair.
Okay.
So it's, you know, it's kind of interesting. So if the hair on the back of your head happens to be black and the top of your hair is a little bit grayer,
yeah,
it actually behaves like the stuff in the back. So oftentimes people will have darker hair from the transplant, which they could, of course, color and do whatever they want with. The hair grows completely normally.
That's so funny. I was going to ask you if the hair on the back of our heads is different at all from the hair on the tops. It is.
Yeah, it actually is. Sometimes
it's not as exposed as the hair up here.
It has a different hormonal composition. So as such, most of the hair at the back of the head, when we say the back, we mean like the horseshoe area in the back. Most of that hair is actually slightly larger as far as the diameter of the hair shaft itself. And at times it could have a slightly different consistency. It could be a little curlier, a little straighter, depending on the individual.
So if someone has a question about whether they're a good candidate for any of these treatments, what is the first step they should take?
The first step is to call your doctor. Find someone who specializes in hair. I always find that it's nice, obviously from my practice standpoint, we do everything from the least invasive stuff to the most invasive stuff. So, we cover every spectrum of hair loss and also most of the treatments. So you want to be able to have someone to give you mostly, a lot of different options. I think that's important because a lot of times, it's not just about, I have a problem with my hair. Well, you need hair transplants.
Right.
We like to think that things are a lot more thought out than that. If someone has a headache, we don't give them morphine.
Right.
We start with something a little bit less invasive like Tylenol. So there's just different ways to approach this. And it's not always just like a 1 or a 0. There's a lot of different things that we can do.
What about those hair bands that I see a lot of now? People use them. Or do those work? Does light therapy at home work?
Yeah. So this is called the laser cap. This is one of the few FDA approved laser devices. We find that they're a nice kind of adjunctive therapy to some of the other modalities. So the nice thing about the laser cap is you use it typically about every other day. People wear it on their heads about 20 to 30 minutes for each session. You can do it at home. They come with like battery packs. So you can just watch TV and wear this thing on your head. We find that the laser light is coordinated to specific wavelengths, and those wavelengths actually stimulate more blood flow to the area, which in turn cause hair growth. It's pretty remarkable. Which, by the way, is a very, very similar modality as something like minoxidil. Minoxidil also it has been speculated to stimulate blood flow to the area, which in turn causes hair to regrow faster. So that's kind of the theory behind the low-level light therapy as well as minoxidil.
So if you're not ready to go in and actually start treatment, maybe because we're home more, you can start with 1, 2, and 3, the supplements, the topical treatment, and something like the cap.
Absolutely. I think it's a really nice place to start, especially for mild hair loss. A lot of times we'll do maybe the cap, we'll do a vitamin supplementation, maybe we'll throw in, we'll do some of the topical solutions, and then potentially PRP. And then we'll wait. And hair therapy is measured in terms of a year. So, let's try this for 6 months to a year. Let's see how things go. Let's circle back, and then let's see where we're at. And depending on how things have progressed, that'll guide our decision making for the next chapter, if you will. So, oftentimes it's really advantageous to start with something less invasive. So let's try the cap, the solution, the supplements, maybe PRP, and then let's see.
And are you doing any telemedicine consultations with people? And is that a good idea for someone who's maybe not ready to go see the doctor, or you can't because of our current, situation?
Yeah, of course. I mean, I can only speak for myself, I guess.
Yeah.
But, we are offering telemedicine visits. We are seeing, I've really enjoyed actually my Zoom time. The last several months I've become a bit of a Zoomer. And we really enjoy the interaction with patients. I think patients are enjoying the experience. There's really a lot we can offer even over the over Skype or Zoom, etc.
Right.
So yeah, we offer that at our office. Although obviously we have a Joint Commission accredited facility that's very, very safe. We test all the patients in addition to screening people. The staff has been tested. So we really find that our office is, especially since we're in New Jersey, which happens to be, knock on wood at this point, a relatively safe state. But obviously we invite people to come in, but if they're not comfortable or they're not ready, we obviously will do Zoom consults as well.
Right. Well, thank you so much, Dr. Wise. This has been super informative. And for our followers who want to read more about what we talked about today, pick up our summer issue. There's an amazing hair story in here, and Dr. Wise is in it. And thank you so much, everyone. Have a wonderful day. Thanks for joining.
Hey, thank you so much. Really appreciate the time.
Bye-bye, Dr. Wise.
Bye, guys.